Hello, I'm Lisa Smith and I'm the youth editor at the Travellers Times. Most of you will already have heard about the coronavirus from the news or heard about it from family and friends, but in case you haven't, I'd like to quickly tell you a little bit about it. Coronavirus is a new type of virus, a bit like the flu. Here are some of the questions we are being frequently asked. Should we be worried about ourselves or our friends and family? Well, we should all be concerned, but we can take measures to protect ourselves. For a start, the virus so far doesn't appear to be affecting children that much. But older people and people who already have medical health problems, such as breathing problems, heart disease and diabetes, should be protected as much as possible so they don't get it. The majority of healthy people who catch it survive and completely recover in about 2 weeks with no lasting ill effects. And sometimes the effect of the disease is so slight that some people recover without even realising that they had it. So how do we know if we've caught this new virus, and what else can we do to protect ourselves and our loved ones? The symptoms of the coronavirus are similar to flu. If you have a temperature and a cough, then you may have caught it. Or it might just be the flu. However, the symptoms won't appear for a few days after you've already caught it. Even among the over 80s, doctors say that 9 out of 10 will recover without any lasting ill effects, and that's the good news. As well as advising elderly people to stay indoors as much as possible, doctors also say that the most effective measure we can take is to regularly wash our hands with soap and water, especially if we have just got home and we've been in a public space. This will help kill any of the virus that's on your hands. Doctors also say that if you're out and about, try and avoid touching your face in case you've picked up the virus on your hands, and when you get home, wash them. They also say cough or sneeze into a tissue or the crook of your elbow, not your hands, and put used tissues straight away in the bin. And avoid close contact with people who are already showing possible symptoms. All of this is very much common sense. What should we do if we think either ourselves or our family and friends have caught the new virus? If you have symptoms or you think you might have been exposed to the virus when travelling or through other contacts, telephone the National Health Service helpline on 111 or visit their online service for advice. Do not go to a GP, pharmacy or hospital unless a National Health Service advisor says so. And remember, most already healthy people under 70 will not feel that ill and will recover without any medical help in about 14 days. Again, a little bit like the flu. The government and the NHS are advising people who have coronavirus symptoms, which are a cough or a high temperature, to self-isolate. This means avoiding close contact with other people, including those you live with, avoiding going out of your home so you don't give the disease to anyone else, and also regularly washing your hands. We realise that this may be difficult in a small home, chalet or even a trailer. However, just do the best you can. Ask friends, families and neighbours if they can help, and try and keep as far away from the elderly and ill as possible until the symptoms are no longer there, and keep washing those hands. Is there a cure? So far there is no cure for the virus, but scientists are working on one and say they hope to have a vaccine or medicines ready to give to people within a year. Yes, it will take this long, they say, because they have to test whether any new medicine is safe before they can make enough of it and share it for everyone. So should our children go to school? What if they catch it there? Some countries are already closing all their schools, but so far the UK government is keeping them open. That may change in the near future. If they do, there will be lots of announcements on the television and radio, so tune in regularly if you can. Remember that doctors say that young people and children should recover if they catch it. Will the shops run out of food? All the supermarkets say that their shops will not run out of food, and they are working with the government to make sure this doesn't happen. They are also asking people not to buy more than they need, to make sure that there is enough for everyone. The good news is that in the countries like China and Italy, which already had big outbreaks of the coronavirus, the shops didn't run out of food and nobody went hungry or starved due to this. How long will all this last? It's really hard to say at this point because the scientists are still studying this new virus. In the meantime, scientists are working on a vaccine to stop people getting it in the first place, and a cure or treatment for the disease itself. Is the government doing anything to help gypsies and travellers in particular? Charities and campaigners for gypsy and traveller rights are calling on the government and councils to not evict any roadside traveller camps, and to also be aware that the gypsy and traveller community has lots of elderly people and people who already have medical health problems like breathing problems, heart disease and diabetes. The Travellers Times will tell you about this if the campaigners get their way on our website at travellerstimes.org.uk, which is regularly updated with news for and about gypsies and travellers by our editorial team. So regularly check out our website and Facebook pages, or ask a friend or loved one to do it for you. Remember, most people who catch the coronavirus will recover in 14 days with only mild flu-like symptoms and no lasting ill effects. But watch out for your loved ones, neighbours and friends. Stay safe, God bless, and Kushti Bok for now.